Your morning routine seems harmless: coffee, breakfast, and your daily medications. But what if I told you that one of those pills could spike your blood sugar to 459 milligrams per deciliter, nearly 5 times the normal level, within hours? This isn't science fiction. It's happening to seniors across America right now, and most have no idea why their glucose readings are suddenly through the roof. Welcome to our Senior Health channel, where we uncover the medical truths that could save your life. If you're new here, hit that subscribe button because what we're revealing today affects 54 million Americans over 65. And if this information helps you, drop a yes in the comments and let us know what state or country you're watching from. Building this health-conscious community together is what drives us to create content like this. Here's the shocking reality. 5 common medication classes prescribed to seniors can dramatically alter blood sugar levels. Some increase diabetes risk by 40%. Others can cause life-threatening glucose swings within days. The most disturbing part? These are the very medications designed to keep you healthy. So the critical question becomes, are your life-saving medications secretly sabotaging your metabolic health? Let's uncover the science-backed truth that every senior needs to know. Corticosteroids, the double-edged sword. Let's start with perhaps the most notorious blood sugar disruptors, corticosteroids. These powerful anti-inflammatory medications, including prednisone, prednisolone, and dexamethasone, are commonly prescribed to seniors for conditions like arthritis, asthma, allergies, and autoimmune disorders. Here's where it gets concerning. Research published in clinical studies shows that corticosteroids can cause blood sugar spikes within hours of taking a dose. One study found that dexamethasone and methylprednisolone caused the greatest degree of hyperglycemia compared to other corticosteroids. The average blood glucose increase with dexamethasone was 16.6 milligrams per deciliter, higher than with milder steroids, while methylprednisolone showed increases of up to 23.9 milligrams per deciliter. But the real shock comes from understanding how this happens. Corticosteroids essentially wage war against your body's insulin system. They make your liver resistant to insulin's signals, causing it to dump excess sugar into your bloodstream even when insulin is present. It's like your liver suddenly becomes deaf to insulin's commands to stop releasing glucose. The elderly face particular risks here. Without close monitoring, seniors taking corticosteroids can develop hyperglycemic hyperosmolar states, a life-threatening condition requiring immediate hospitalization. One study specifically noted that approximately 40% of all hospital endocrinology consultations involve steroid-induced diabetes, or diabetes worsened by steroid use. What makes this even more dangerous is the timing. Research shows that taking high doses of prednisolone, 7.5 milligrams daily or higher, or dexamethasone at 0.75 milligrams daily or higher significantly increases your risk. The good news? These effects are typically reversible once the medication is discontinued, but some individuals may develop permanent type 2 diabetes, especially those already at risk. Statins, the cholesterol paradox. Now let's examine one of the most commonly prescribed medications for seniors, statins. These cholesterol-lowering drugs, including atorvastatin, rosuvastatin, and simvastatin, are taken by millions of Americans over 60. But here's the paradox that's keeping researchers up at night. A groundbreaking study from the Cholesterol Treatment Trialists Collaboration involving 154,664 participants across 23 large-scale trials revealed something startling. Statins cause a small but measurable increase in blood sugar levels, which can push people who are already at high risk of diabetes over the edge into full-blown type 2 diabetes. The numbers are sobering. Participants taking lower doses of statins had a 10% higher risk of developing new-onset diabetes, while those on higher doses faced a 24% greater risk of worsening blood sugar levels if they already had diabetes. Research published in the Cleveland Clinic Journal of Medicine confirmed that higher-intensity statins and higher doses are associated with the highest risk. But here's what's particularly concerning for seniors. The risk isn't uniform across all statins. Studies show that atorvastatin and rosuvastatin carry the largest risk of blood sugar problems. In contrast, pitavastatin and pravastatin may actually have neutral or even slightly beneficial effects on glucose levels. One study found that about 9% of people using statins experience elevated blood sugar levels. The mechanism appears to involve making your body's cells resistant to insulin, the same hormone that helps move glucose from your bloodstream into your cells, where it can be used for energy. The clinical impact is real. Research shows that treating 255 patients with statins for 4 years led to 1 extra case of diabetes, but prevented 5.4 cardiovascular events. So while the diabetes risk exists, the cardiovascular benefits generally outweigh the metabolic risks for most seniors. However, this makes regular blood sugar monitoring absolutely crucial for anyone over 60 taking these medications. Blood pressure medications. The pressure points. Blood pressure medications present a complex landscape for seniors, with some classes posing greater risks to blood sugar control than others. Let's unpack this carefully, because hypertension affects the vast majority of seniors, making these medications nearly unavoidable for many. Research reveals that not all blood pressure medications are created equal when it comes to glucose effects. Beta blockers, particularly older, non-selective ones like propranolol, can mask the warning signs of low blood sugar while simultaneously making blood sugar control more difficult. Studies show that beta blockers can increase the risk of developing diabetes by 28% compared to other blood pressure medications. Here's the mechanism that's particularly troubling. Beta blockers can reduce insulin sensitivity and interfere with glucose metabolism. They can also mask important hypoglycemia symptoms like rapid heartbeat and tremors, making it dangerous for seniors who might already be at risk for low blood sugar events. Thiazide diuretics present their own challenges. While the systolic hypertension in the elderly program showed that low-dose thiazides like chlorthalidone can be beneficial for preventing cardiovascular events in seniors, higher doses can negatively impact glucose metabolism. The key is dosage. Lower doses of 12.5 milligrams per day of hydrochlorothiazide are generally well tolerated without adverse metabolic effects. Interestingly, calcium channel blockers and AC inhibitors appear to be metabolically neutral. Research comparing different blood pressure medication classes found that calcium channel blockers and AC inhibitors did not exhibit the diabetes-promoting effects seen with beta blockers and higher-dose diuretics. The clinical implications are significant. In one major study comparing different blood pressure medication strategies, the beta blocker/thiazide combination led to new-onset diabetes in 8.3% of patients, while the calcium channel blocker ACE inhibitor combination resulted in diabetes in only 5.9% of patients. For seniors managing both hypertension and diabetes risk, the choice of blood pressure medication becomes critically important. The goal is achieving blood pressure control without compromising metabolic health. Antidepressants. The mood and metabolism connection. The relationship between antidepressants and blood sugar control presents one of the most complex puzzles in senior healthcare. Depression affects up to 20% of adults over 65, making antidepressants commonly prescribed medications in this age group. But the metabolic effects of these drugs tell a fascinating and sometimes contradictory story. Let's start with the surprising findings. A comprehensive systematic review analyzing data from multiple studies found that some antidepressants can actually improve blood sugar control. Selective serotonin reuptake inhibitors like fluoxetine, citalopram, and escitalopram significantly lowered blood sugar levels compared to placebo in people with type 2 diabetes. This challenges the common assumption that all antidepressants negatively impact glucose metabolism. However, the picture becomes more complicated when we examine individual cases and longer-term studies. Case reports have documented severe hyperglycemia occurring within 3 weeks to 5 months after starting antidepressants like paroxetine, clomipramine, and mirtazapine. In these cases, blood glucose levels reached as high as 459 milligrams per deciliter, a potentially life-threatening level. A large Japanese cohort study involving health insurance data provided more concerning insights. The research showed associations between antidepressant use and increased risk of developing type 2 diabetes, particularly with higher doses and longer duration of treatment. The mechanisms proposed include weight gain, changes in insulin sensitivity, and direct effects on glucose metabolism. What makes this particularly relevant for seniors is the complexity of the risk factors. Older adults taking antidepressants often have multiple health conditions, take multiple medications, and may experience changes in physical activity and self-care behaviors that can independently affect blood sugar control. The research suggests that while short-term use of certain SSRIs might actually benefit glucose control, prolonged use of various antidepressant classes could increase diabetes risk. This creates a delicate balancing act for healthcare providers treating depression in seniors who are already at risk for metabolic disorders. Antibiotics, the unexpected culprits. Here's where our investigation takes a truly surprising turn. Most people would never suspect that antibiotics, medications we rely on to fight infections, could significantly impact blood sugar levels. But the research reveals a disturbing truth about certain antibiotics, particularly fluoroquinolones. The FDA issued a major safety warning in 2018 specifically about fluoroquinolone antibiotics and their potential to cause dangerous blood sugar fluctuations. These antibiotics, including ciprofloxacin, levofloxacin, and formerly gatifloxacin, are among the most commonly prescribed antibiotics in North America. The numbers are staggering. Research involving Ontario residents aged 66 and older found that patients treated for low blood sugar were over 4 times more likely to have received gatifloxacin in the preceding 30 days compared to other antibiotics. When compared to macrolide antibiotics like azithromycin, gatifloxacin showed an adjusted odds ratio of 16.7 for causing hyperglycemia, meaning the risk was nearly 17 times higher. But here's what's particularly dangerous for seniors. These blood sugar swings can occur without warning and can be life-threatening. Case reports document hypoglycemic comas resulting in death, with most cases occurring in elderly patients or those with diabetes taking blood sugar-lowering medications. The mechanism involves the antibiotic interfering with potassium channels in pancreatic beta cells, similar to how some diabetes medications work. This can cause unpredictable surges in insulin release, leading to dangerous drops in blood sugar levels. A systematic review and meta-analysis confirmed that fluoroquinolones as a class are associated with significantly increased risk of hypoglycemia, although there appears to be variation within the class. Levofloxacin and gatifloxacin showed the highest risk, while ciprofloxacin showed less association with blood sugar problems. What's most concerning is that many seniors have multiple risk factors that increase their vulnerability: advanced age, kidney problems, diabetes, and concurrent use of other medications that affect blood sugar. When these factors combine with fluoroquinolone use, the risk of severe blood sugar abnormalities increases dramatically. Other common medications and hidden risks. Our investigation wouldn't be complete without examining several other medication classes that seniors commonly encounter. These drugs might not make headlines, but their impact on blood sugar control can be just as significant. Protease inhibitors, used in HIV treatment, have been linked to increased diabetes risk. Studies show that as many as 1 in 4 people develop new diabetes within 3 years of treatment, particularly concerning for older adults who may already have other diabetes risk factors. Calcineurin inhibitors, commonly used after organ transplants, including cyclosporin and tacrolimus, have been associated with increased diabetes risk, especially when combined with corticosteroids. This combination can be particularly challenging for seniors who have undergone transplant procedures. Even seemingly innocent over-the-counter medications can play a role. Niacin, used to treat high cholesterol, can cause significant increases in blood sugar levels. Some cold and allergy medications containing pseudoephedrine can also affect glucose control. The picture that emerges is one of complexity and interconnection. Many seniors take multiple medications simultaneously, creating potential for drug interactions and cumulative effects on blood sugar control that may not be immediately apparent to either patients or their healthcare providers. What this means for you. Practical protection strategies. Now that we've uncovered these hidden risks, let's focus on what you can do to protect yourself. Knowledge without action is just information. Let's turn this into a practical protection plan. First, inventory your medications. Create a complete list of everything you take, including prescription drugs, over-the-counter medications, and supplements. Note when you started each medication and whether you've noticed any changes in your energy levels, thirst, urination, or overall well-being since starting them. Second, establish baseline monitoring. If you're taking any of the medications we've discussed, regular blood sugar monitoring becomes crucial even if you don't have diabetes. Consider investing in a home glucose meter and test strips. Many pharmacies offer free diabetes screenings, and you should request hemoglobin A1C tests during routine checkups. Third, timing matters. Be aware that medication effects on blood sugar can occur within hours to months of starting treatment. Keep a simple log noting any unusual symptoms like excessive thirst, frequent urination, unexplained fatigue, or dizziness, especially after starting new medications. Fourth, communication is key. Create a medication review schedule with your healthcare providers. Don't assume they automatically know about all the medications you're taking, especially if you see multiple specialists. Bring your complete medication list to every appointment. Fifth, understand your personal risk factors. Age over 65, family history of diabetes, being overweight, having high blood pressure, and taking multiple medications all increase your vulnerability to medication-induced blood sugar problems. The evidence we've examined today reveals a critical truth that every senior needs to understand. The medications designed to help manage one health condition can sometimes create entirely new health challenges. This isn't about fear-mongering or discouraging appropriate medical treatment. Instead, it's about empowering you with knowledge to be an active, informed participant in your health care. The research clearly shows that corticosteroids can cause dramatic blood sugar spikes. Statins can increase diabetes risk while providing cardiovascular benefits. Certain blood pressure medications carry more metabolic risks than others. Antidepressants present a complex picture of both risks and potential benefits. And some antibiotics can cause life-threatening blood sugar fluctuations. But here's the empowering part. Awareness creates opportunity for prevention and early intervention. When you know what to watch for, when you understand your medication's potential effects, and when you maintain open communication with your healthcare team, you can navigate these challenges successfully. Remember, this information isn't meant to replace medical advice or encourage you to discontinue necessary medications. Instead, it's meant to help you become a more informed healthcare consumer who can work collaboratively with medical professionals to optimize both your treatment outcomes and your overall metabolic health. The goal is finding the right balance, managing your existing health conditions effectively, while minimizing unintended consequences on your blood sugar control. This often requires careful medication selection, regular monitoring, and sometimes creative treatment approaches that prioritize your overall well-being. Take action today. Review your medications, schedule a comprehensive medication review with your healthcare provider, and consider establishing a blood sugar monitoring routine if you're taking any of the high-risk medications we've discussed. Your health is your most valuable asset, and staying informed is one of the most powerful tools you have for protecting it. By understanding these medication effects and taking proactive steps, you're not just managing your current health, you're investing in your future vitality and independence. If this video was helpful, kindly type yes in the comment. That motivates us to produce more content like this. Don't forget to like this video if it provided valuable insights. Share it with family and friends who might benefit from this information, and subscribe to our channel for more evidence-based senior health content. Thank you for taking the time to learn about this important topic. Remember, knowledge is power, and you now have the power to make more informed decisions about your medications and your health. Until next time, stay informed, stay healthy, and keep advocating for your best possible care.